Hi there, and welcome to A&P with Dr. O. In this video, we're going to go ahead and focus in on the liver and the gallbladder. We are taking a look at the anterior surface of the liver. From this view, we can see the right lobe of the liver. We can also see the left lobe of the liver. And then we can also go ahead and see some ligaments here. So we have this coronary ligament here that we can see. And then we can also see the falciform ligament. I'm going to go ahead and turn the liver over, and then that way we can take a look at the posterior surface. Now we're looking at the posterior surface. We can still see the coronary ligament on the posterior surface here. We can also see here the inferior vena cava, and then branching off from that is going to be the hepatic vein. We still have our right lobe and our left lobe that we can see, but now we can see our two additional lobes as well. So we have this lobe that's going to be down here by the gallbladder. So here's our gallbladder. We have a lobe that's going to be next to that gallbladder. That is the quadrate lobe. And then we have this lobe right here, and that's going to be the caudate lobe. We have this area here where we have some additional blood vessels and ducts. So this area here, or this region here, is known as the porta hepatis. Porta hepatis means doorway to the liver. You can think about this as being a doorway for vessels and ducts. We've already done our inferior vena cava here, and then this branch is going to be our left hepatic vein right here. We can also see our hepatic portal vein. So that's going to be this vessel here, and it's going to be in the porta hepatis. Also in the porta hepatis is going to be the hepatic artery proper. That's this vessel here, the hepatic artery proper. When we take a look at the gallbladder, we can also see the cystic duct coming from the gallbladder here. So here would be that cystic duct. And then we've got the hepatic ducts over here. And then they're going to be joining to form the bile duct. I went ahead and shifted the model slightly and zoomed in so we can see that porta hepatis and associated structures a little bit better. Again, here is the porta hepatis. This region is known as the doorway to the liver, our porta hepatis. There we have our hepatic portal vein. We have our hepatic artery proper. We have our gallbladder, our cystic duct, our common hepatic duct, and then our cystic duct and common hepatic duct come here to join and form the bile duct, or sometimes called the common bile duct.